Hey Kenneth, how you doing today?
Doing all right.
Okay, so I see that you've fallen off your skateboard, landed on your wrist,
Yeah,
and you didn't break it, but you maybe have some inflammation and pain going on in there.
I do.
Okay. All right, so I think maybe something that you'd be interested in is trying just a cold pack to reduce some of the inflammation and decrease range of motion that you've experiencing. Um,
Okay.
does that sound like something you'd be interested in?
Yeah, that does.
Okay, cool. So before we do that, I just want to go over some of the things we call them contraindications that might um, make you not so good of a candidate for this modality. So I just want to make sure you don't have any cold intolerance, sensitivity to the cold,
No.
hypersensitivity, any cold allergies,
Mm-mm.
regenerating peripheral nerves,
Nope.
no nerve damage lately, compromised circulation to
No.
the area, anything like frostbite.
No, it's all good.
No, okay. And you can feel that area just fine. There's no decrease in sensation there.
No, still
Everything
got my
feels
sensation. Just
totally
got a lot
normal.
of swelling and inflammation going on.
Okay, great. So it sounds like you're a really good candidate for the cold pack. So I just wanted to, before we apply it, I want to talk about some of the feelings that you might get when we put the cold pack on. So an easy way to remember it is just to remember CBAN, and it's coldness, burning, aching, and numbness. So in that order, when we first apply the cold pack, you'll feel just the cold sensation, and it will eventually lead to a burning sensation, and then it will start to ache, and finally it will go numb. So this treatment is going to go on for 15 to 20 minutes. But if it goes numb, if it reaches that numbness point before the 20 minutes is up, then just go ahead and stop the treatment, and that'll be a good enough job. Does that sound good?
That sounds good.
Okay, so I'll show you how to um, kind of set up for this treatment. The first thing that you're going to do is I think you should just lay down a towel since you'll be doing this at home. You just don't want it leaking all over the tabletop. So next, you'll just take a pillowcase and you just want to moisten it in the sink. Don't get it soaking wet or it'll really get all crunchy and everything from the cold pack. So you'll just get it moist in the sink. Take your cold pack and you can go buy one of these from a store, or you can just like use a bag of ice. So you'll put the cold pack into the pillowcase, fold it over a couple times, wrap it up, and then if you just raise your wrist up for me. So place your wrist onto the cold pack, wrap it around, and then you can go out and get one of these ace bandages, and all you're going to do is wrap the ace bandage from like the furthest part on your wrist up towards the shoulder. That's just done so that you can kind of get some of the blood flow moving back up towards the body.
You want to go all the way up to my shoulder?
No, sorry. So what you want to do is just go from the wrist area and just work your way towards that direction.
Okay.
Okay, so you'll stop pretty close to right after the cold pack.
Okay.
Okay, so I'll just demonstrate it for you really quickly. So we'll start a little further out towards your hand. And when we're wrapping it, you just want to apply a little bit of pressure, not too much, don't make it too tight and cut off circulation, but maybe like 5 pounds of pressure. So you'll just come up and wrap around, and you don't have to go any further than that really, and then you can just tuck the bandage in right there and just let it sit. So like I said, 15 to 20 minutes, you'll feel the coldness, burning, aching, numbness. Once you reach the numbness, you can stop the modality. Does that sound good to you?
Sounds good.
Okay, do you have any more questions for me?
Is it supposed to be red or any type of different
Yeah, that's a
discoloration?
great question. So when you have the ice pack on, you want to make sure to frequently check, just like peek under the ice pack, make sure that it's not too cold and damaging the skin, and that would just be indicated by like severe redness. So you will, when you take the ice pack off, it's completely normal to have mild redness, but that should just go away within maybe a few minutes to a couple hours, and that's no big deal.
Okay.
Okay. All right. So what I've done is I made you a little pamphlet. So if you have any questions in the future, you can just refer to that. And I sent that to your email so you can reference it. anytime you need to. But if you have any further questions, feel free to give me a call. Does that
Okay,
sound good?
sounds great.
All right, thanks, Ken.
No, thank you.
All right.